All right, I think we'll get started. There'll be some people trickling on here, but I want to make sure we stay in our time zone. Again, I'm John Randall from GoldenCare Regional Director. Um, I'm very thankful for all you people joining us today. I wish everybody a happy new year. GoldenCare is striving to make 2021 a great year for everyone. We want to continue to bring you new products, strategies, sales tips, value added benefits, and a superior back office support group. So we have great regional directors and marketing support team here to help you, along with a great licensing team and a new business team. So if you haven't went to our website ever, www.goldencareagent.com, go check out all the extra value-added tools that we give to our agent. I just really want to make this a good year. And today we are lucky enough to have Steve Moses with us, the president of the Center for Long-Term Care. If you're not a member of that, you should really sign up, especially if you do anything with Medicare, Medicaid, or for sure long-term care. He is by far one of the top specialists in the nation, and I'll tell you a little bit more about him as we go on. I do want to introduce you to our new program called the Integrity Direct Longevity Planning Referral Program. It is an awesome new thing. We just put it out not too long ago, and we're having great success for it. Really, what it does, we take all the hassle out of being contracted with carriers, producer certifications, Department of Insurance appointments. We do it all for you. You just register it, mention it to somebody, refer them to us, and then get paid. We will send these slides out today so you get a chance to look at it. But go to www.integrityltcdirect.com to learn more. Right now, we know about 70% of people are going to need some type of long-term care during their life. But you know what? 90% of the people have never had any discussion about it. Today we have Dennis Reiner, one of our long-term care training specialists on, and he will give you a little bit more insight on this longevity planning program because he's actually had some really good success with it already. So Dennis, if you would like to take a few minutes and explain it.
That'd be great. Hey, thanks, John. And John, you said it really well, and thank you, everyone, for joining our call. I think you're really going to enjoy Steve. He is a living expert, really, on long-term care, and really, as we've seen over the years, the changes in the marketplace. And maybe just a quick little to tell you, the genesis really of this program came from our agents who had, some who had been specialists over the years, and as the marketplace changed, we heard from so many that said, gosh, I'm having such a hard time keeping up with all the new products. My practice has shifted. I'm doing more in Medicare. I'm doing more in life or annuities, but I still want to be able to have a way to bring up this conversation of long-term care. And so that's really how we started this process, was to make it easy for individuals to still fulfill fiduciary responsibility, to have the opportunity to be an advocate for their clients, but not have to deal with all the other messiness that John was referring to, the carrier contracts, the producer certifications, the DOI appointments. And so really this program makes it so darn easy for you just to register. You bring it up, as John said. When you refer, you will get rewarded, and then you can repeat the process all over again. It's that easy. And your clients win, and you win. And here we have specialists who literally write millions of long-term care premiums. They know all the carriers. They know the changes in the underwriting guidelines. They know how to position the products based on your client's health, their age, and their budget. And they'll do it all for you. And they stay in their lane and only talk specifically about long-term care. So as John said, please go to www.integrityltcdirect.com. It's been said that an in-depth look always reveals more than a casual glance. Don't just take a casual glance. Take an in-depth look. I think you'll really enjoy having this resource available to you. For those of you who are not the do-it-yourselfers, who don't want to really eat, sleep, and drink long-term care, we have this solution for you, and we are having some very good success with individuals and organizations who basically say, gosh, we finally have a way by which we can have a shopping service that will do all of this for us and for our agents. And so I'll turn it back over to you, John, and look forward to hearing Steve's comments as he, again, is going to share insights on how the marketplace has shifted. But we know this, that the long-term care concern is not going away. It's getting more and more, affecting more and more individuals. And we want to make sure that we have, as John said, outlets and resources available for you. And this is another tool that you can take advantage of. And it's so easy. It just takes you a minute to sign up, and it takes you a minute or two when you want to refer someone. So check it out. And a byproduct of all that you do, you still get paid, which is a great thing. And again, it's a win-win situation. So back to you, John.
Thanks, Dennis. Very good synopsis of that. One more quick thing before we get going here. All attendees today can participate in a raffle. We'll have a $50, $100, and $150 Amazon card. Just text WIN to 89800, and at the end of the presentation today, we will go ahead and announce our winners and get those Amazon cards out to you. But now, let's go to what we're focusing on here. Oh, I skipped right through it. There we go. Steve Moses, thank you so much, Steve, for coming on today. It's a pleasure to talk to you again. You've been a longtime friend of GoldenCare and one of the best advocates for long-term care. I could go on and on about his accolades. I'm just going to give you a quick little preview of it here, which you can also read on here. Nursing Home Magazine reported there's probably no one more articulate spokesman for privately financed long-term care than Steve Moses. Today we have Steve, the president of long-term care, or president of the Center for Long-Term Care. The center promotes universal access to top quality long-term care by encouraging private financing. That's what we're all about. We need to all get out there, encourage private financing. If you can look at his thing, we'll leave this up here so you can read it. He's got a long list of credentials of why he is such an expert on the whole thing about long-term care and Medicaid, especially if you take a look at his jobs and his what basically he's devoted his life to. He's held a lot of great positions. If you've never heard him talk, you're going to love this. He's great. He's got all the inside information. He's wrote many, many articles and gave many speeches around the nation. And if you've heard him before, like I have, you don't want to miss anything that he says. So thank you, Steve, for coming on. I'm going to turn it over to you, and we all appreciate it.
Well, great. Thank you, John and Dennis and GoldenCare USA, my favorite company in the business. It's wonderful to be with you today. My topic today is long-term care and the pandemic. You know, we've been through an earthquake. Life as we've known it has changed radically. There are huge opportunities resulting, but giant risks as well. Long-term care and LTC financing are more interesting, challenging, and frankly fun than ever before in my 38 years following this field. The opportunity to do well by doing good, selling long-term care insurance, has never been greater. You producers, distributors, and the carriers you represent to consumers are critical to our country's surviving this crisis and prospering in the future. Now, I'm going to cover this topic from the standpoint of three themes or contexts. First, health and long-term care. Second, the economy. and third, politics. Now, LTC clippings since last month, December 2020, are the source for most of what follows. LTC Clippings is a publication we produce that is sponsored by GoldenCare USA. We send an average of 2 clippings per day by email to subscribers. Each clipping gives the title, a link to the source, a representative quote, and a couple sentences of my analysis to put the information in context. The purpose of LTC clippings is to inform agents of news, data, reports, articles, etc., that they need to know before they're blindsided by prospects or clients who've read something in the media that the agents haven't seen yet. That can be very embarrassing. I'll make today's presentation and all the links to original stories it covers available in our next LTC Bullet. That's another publication we do, to be published on Friday. That same day, it will be posted on the Moses LTC blog at www.centerltc.com. That's the Center for Long-Term Care Reform's website, www.centerltc.com. So you can find all of this there. My point, if you had received the LTC clippings, you would know all of what I'll say today already and be armed with it as you confront those people out there that need to know what you have to tell them. If you're blown away and you want to subscribe, you can check out our membership levels and benefits link and our Join and Contribute Online link. Both links will be live in the LTC Bullet on the blog. Now let's dive in. I first want to acknowledge some experts that I consulted in preparing this presentation, Claude Thao, Sally Leinbach, and Margie Berry. And I particularly suggest you watch for 2 forthcoming white papers by Margie Berry titled The Impact of COVID-19 on Long-Term Care and the Medicare White Paper. Okay, long-term care is in the news like never before. That's a big change, for better and for worse. On the bad side, people are dying in long-term care facilities. Even though 1% of the US population resides in a facility, 4 in 10 COVID-19 deaths have occurred in one. I covered the causes, consequences, and proposed solutions to this problem in my June 1st, 2020 op-ed published by the Wall Street Journal titled Nursing Homes, Coronavirus, and Medicaid. There'll be a link to that in this material. And if you can't access it because you don't have a subscription, you're welcome to email me and I'll send you a copy. Now, on January 1st, 2021, just 4 days ago, the New York Times published heart-wrenching stories about people who have been trapped in nursing homes, watching friends and fellow residents sicken and die around them. Long-term care providers have been devastated. The dual factors of sharply declining occupancy, down from 85% in February to 74% in September, coupled with the high cost of personal protective equipment, COVID-19 testing, and hazard pay for workers, is placing the skilled nursing sector under unsustainable financial strain. 2/3 of nursing homes say they won't make it another year given the current operating pace due to increased COVID costs. Staffing has been the top cost in response to COVID, with 9 out of 10 nursing homes hiring additional staff and or paying staff overtime. The COVID-19 pandemic will contribute to substantial elder care cost hikes, especially for assisted living and in-home care. Over the course of a single year, Assisted living community rates increased by 6.15% to an annual national median cost of $51,600. And that was all pre-COVID. The United States spent a collective $172 billion on care at nursing homes and continuing care retirement communities in 2019. That's a gain of 3.3% from the year before. But that increase pales in comparison to the 7.7% jump in spending on home health services during that time, from $105 billion in 2018 to $114 billion in 2019. There is a severe shortage of healthcare workers at all levels. Notwithstanding sign-on bonuses, competitive salaries, and benefits packages, recruiting caregivers is a challenge. One home health provider said, before the pandemic, I used to get 10 applicants a week for our open positions. Now I'm getting 1 or 2. You know, people aren't exactly lining up for minimum wage jobs in COVID's bullseye with higher unemployment benefits readily available. Go figure. COVID had a crazy impact on healthcare costs well beyond the long-term care area. Hospital costs are down 36%, due mainly to elimination of non-critical services such as elective surgeries. Dental care is down 65%. When was the last time you saw a dentist? Flu cases are lower than normal this year because of measures taken to avoid COVID-19. How is the public reacting to all this? Well, people want to stay home and they want to keep their parents at home. The number of COVID-19 cases and deaths for home and community-based services programs pales in comparison with those for nursing homes. After researchers compared positive COVID-19 cases and deaths in 3 Medicaid home care programs to results for nursing home and assisted living residents for March through July, they found that only 3% of older home care adults were infected, and only 1% died from COVID-19. Meanwhile, nursing home and assisted living residents showed a 37% positivity rate and an 11% death rate. 61% of Americans now report that they would rather die than live in a nursing home. Americans prefer to stay in their home for long-term care, 71%, and most would like to have the option of relying on a family member if they needed long-term care, 68%, but would not expect them to provide the care if they were unable to pay, 69%. Do you see the role for private long-term care insurance there, which empowers people to get the care they need and allows their loved ones to provide love and support rather than the hands-on care itself? The vast majority of Americans, 87%, believe it's more important than ever for people to stay at home for long-term care, as well as have a plan for long-term care, 85%, and have long-term care insurance, 81%, as COVID-19 has raised concerns about the safety of nursing homes. Wow, where have we seen numbers like that ever before? There will be more cost and more cost increase awareness. Nursing homes, assisted living, and home care costs will rise further, especially for home care. Long-term care insurance prices are rising, especially for hybrids. According to Margie Berry, virtually all carriers have increased their premium rates, and most have limited the application age to 70. The impact on traditional long-term care insurance products has been more limited, but Stricter underwriting requirements keep coming along. Applications may be postponed if someone has been outside the country within the past month or in contact with somebody who tested positive, or if quarantined even with no diagnosis or symptoms. Simultaneously, Medicare is pushing more costs onto consumers to ensure that Medicare remains financially viable, which it's not likely to do. A number of major changes have been introduced over the past several years. So-called value-based care means fewer services being provided to beneficiaries. People are being sent home from the hospital and nursing home too soon. Too soon. Medicare has changed the payment process. Hospitals will now control the distribution of payments for all parts of the long-term care continuum. For details, I suggest you read Margie's forthcoming white paper, the Medicare white paper. Sensitivity to risk is very high. The unpredictability of life and health is on everyone's mind. A majority of today's workers and retirees range from feeling cautious to pessimistic about the economic outlook for 2021, with nearly 75% concerned about how the global pandemic may impact their retirement savings. People are more aware of their own and their parents' vulnerability. Will we have more pandemics? Different ones? Worse ones? Will the one we have cause problems such as brain issues going forward? Although almost every household with an income of $100,000 or more reports saving for retirement, only half of them, 49%, say they believe they will ever be able to retire. According to an analysis of applicants for traditional long-term care insurance in 2009.
Yeah, we can hear you again. We missed a few minutes there.
Yeah, for some reason, the Wi-Fi I'm on went on the blank, so I apologize for that.
Okay. No problem. Thanks for coming back.
But do let me know instantaneously if this should happen again. People are more aware of their own and their parents' vulnerability. Will we have more pandemics? Different ones? Worse ones? More complications with this one as effects on the brain over time? Although almost every household with an income of $100,000 or more reports saving for retirement, only half of them, 49%, say they believe they will ever be able to retire. According to an analysis of applicants for traditional long-term care insurance in 2019, decline rates ranged from 19.4% for individuals applying between the ages 40 to 49 to 56.6% after age 75. Couples comprise the majority of traditional long-term care insurance applicants, explains Claude Thao. The likelihood that at least one spouse will be declined ranges from 35% for spouses between ages 40 and 49 to 78.5% for couples age 75 or older. Insurability is declining just as urgency for consumers is increasing. Insurance companies are wary to take on applicants who have had the virus or been exposed to it. Intelligent people who realize this are more inclined to purchase long-term care insurance while they still can prove that COVID-19 has not yet compromised their health history. New and different products are available and catching hold. Hybrids provide a wide range of benefits. Traditional products still offer the biggest leverage against LTC risk for the least cost. But carriers face increasing costs and consumers confront higher premiums and or reduced benefits due to the government's artificially low interest rates. Now, in the meantime, Susie Orman tells people you must have long-term care insurance. Virtual marketing and sales via face-to-face electronic connections make long-term care insurance easier and less expensive to sell, eliminating drive time, for example. People will be back to work after the vaccine, so their future financial outlook will become more stable. Bottom line, there's never been a better time to sell long-term care insurance. Now let's examine the situation from the standpoint of the economy. The American economy right now is characterized by irresponsible fiscal and monetary policy by the government. Just consider the national debt, and I'll give you links in this document to the national debt clock. For 2008, the beginning of Obama's first term, the national debt was $9.6 trillion. It took us over 230 years to get to that point. By 2016, it was up to $19.2 trillion. Currently, we're looking at a national debt of $27.8 trillion. And in just 4 years, in 2025, everything continuing on the same course, it will reach almost $49 trillion. You see a trend there? So-called stimulus to confront the economic downturn caused by the pandemic has resulted in these huge deficits and rampant money printing by the Federal Reserve to monetize the skyrocketing debt. All this new money had to go somewhere. It didn't inflate consumer prices so much because of low demand suppressed by high unemployment. So instead, we've seen rapid inflation in equities, stocks and bonds, and real estate. Ironically, in economic crisis, stock markets are at all-time highs. Home prices rose 8.4% in the year that ended in October, reaching a 14-year high. People working from home with shorter or no commutes are looking for larger homes in suburbia, offering more space, better home offices, and a place to provide home care, if needed, for themselves or their parents. The result is that we have more upper middle class people, exactly the demographic cohort most likely to consider and buy long-term care insurance. They have more wealth to protect and more money for premiums. People going back to work after the vaccines kick in means a bigger worksite marketplace. On the negative side, inequality is exacerbated. Elderly poor get poorer even as the rich get richer. There will be more elderly debt. Adults age 70 and older have increased their debt since the Great Recession, largely due to mortgage payments. And this hampers their ability to overcome negative events as they age. Substitute a long-term care crisis for negative events, and you can see what this means. The elderly poor get poorer even as the rich get richer due to irresponsible monetary policies that inflate stock and real estate values. What this means in terms of long-term care is that more people will depend on Medicaid when Medicaid is least able to support them. The good news is that the well-to-do will have more wealth to protect and more money to pay premiums for long-term care insurance. So the current mess in LTC services and financing will worsen. Medicaid will continue to deteriorate, and private long-term care insurance will become more desirable and saleable than ever before. Bottom line on the economy, there's never been a better time to sell long-term care insurance. Now let's look at the political context. As I prepared this presentation before the Georgia Senate runoff elections, it was impossible to predict what the future might hold politically. Would the Democrats win control of the Senate, taking the trifecta of President, House, and Senate? That would free them to pursue the Democrat Party's left wing's most radical progressive wish list. Or would the Republicans hold control of the Senate and remain a bulwark of opposition to the goals of Bernie Sanders, Elizabeth Warren, and Alexandria Ocasio-Cortez? It was a cliffhanger, but now we pretty much know the result. Warnock beat Loeffler, and it looks like Ossoff beat Perdue, though that race has not been called yet. If everything plays out the way it looks like it will, the Democrats will control the presidency, the House, and the Senate. It appears the Democrats have taken both Georgia Senate races and so will control both houses of Congress as well as the presidency. Vice President Kamala Harris will cast the deciding vote in case of a 50-50 tie on key issues. We'll likely see more progressive measures pass, more spending approved, more money printing to cover it, and higher national debt than otherwise. Only time will tell what the long-term results of such policies will be. Now, let's turn now to the political context. As we've seen from the economic context, there isn't much concern for financial responsibility anymore in either party. So we have to ask, will modern monetary theory, the idea that the government can print and spend unlimited amounts of money without consequences, will MMT prevail, allowing progressives to pursue their whole bucket list of goals, including free long-term care provided by Medicare? That would finally wipe out private long-term care insurance. Actually, the Biden administration's LTC wish list is much less ambitious. According to the Biden-Harris plan to make nursing homes and long-term care facilities safe, the Biden administration's whole focus is on regulation and enforcement. For example, they want to promote safety and care, ensure appropriate oversight of facilities to protect patient safety and well-being, provide oversight for how taxpayer and resident funds are spent, and provide avenues for bringing complaints, and so on and so on. It's all nice sounding ideas, but what they mean is that there will be more inspections, more fines, more financial penalties, not more money and support for the desperately underfinanced Medicaid care that most of these places are forced to provide. In a phrase, the beatings will continue until morale improves. The Biden plan for older Americans also addresses long-term care by promising to protect Medicare as we know it. Well, the Congressional Budget Office now projects that the Medicare Trust Fund will be exhausted in 2024. That's just 3 years from now, a little more than 3 years, which is the nearest the fund has come to exhaustion in the 55 years of its existence. The Biden plan will protect Medicaid funding and make sure the program gives those on Medicaid who need long-term care the flexibility to choose home and community-based care. Well, heavier than ever reliance on Medicaid, a bankrupt welfare program, is a mistake. Making Medicaid long-term care more attractive by offering more home care does not save money and further reduces consumers' perception of LTC risk. If I can get home care paid for by the government, why should I worry 30 years before I need it about how to pay for it? Consider Medicaid's well-known deficiencies: access and quality problems, notoriously low reimbursement rates, discrimination, institutional bias, loss of independence and control. But add to these some new defects. Managed long-term care through Medicaid is increasing, adding another layer of compensation and control between the patient and provider. Over half of states contract with managed care organizations to provide LTC services. GAO examined 6 states, each of which reported finding significant problems with the quality of care provided through these contracts. In some cases, the problems led to patient injury or neglect. On top of that, the true Medicaid improper rate now exceeds 25%, meaning that more than 1 in every $4 spent in the Medicaid program, or more than $100 billion in federal spending each year, is in violation of program rules. It turns out that millions of Medicaid enrollees are ineligible for the program, in most cases because they earn too much income, but in others because they are not lawful residents. The Biden plan promises a $5,000 tax credit for informal caregivers. But we like tax deductions and credits, but this isn't what the insurance industry was hoping for. It is not above the line LTCI tax deductibility. It is not cafeteria plan eligibility for LTCI. Rather, it is a benefit that further reduces the public's concern for their personal responsibility to plan for long-term care. Biden will increase the generosity of tax benefits for older Americans who choose to buy long-term care insurance, and they'll pay for it using their savings for retirement. Well, that's a good idea. Let people access their retirement to pay their premiums for long-term care insurance. But it's a drop in the bucket compared to what needs to be done. Biden made a very unpromising first political appointment. He appointed California's Attorney General, Xavier Becerra, to run the Department of Health and Human Services, under which the Centers for Medicare and Medicaid Services resides. Becerra was a big supporter of the Class Act and all of Obamacare, which doesn't exactly endear him to those of us who understand what a disaster the Class Act was. Furthermore, Biden wants to lower the Medicare age to 60. That makes me ask, what happened to Medicare for all? Medicare at 60 is Medicare forgotten. Hospitals fear adding millions of people to Medicare will cost them billions of dollars in revenue, so they're not on board. Medicare at 60 is just one more way for governments to say, don't worry, we'll take care of you, just before the bottom falls out of the Medicare trust fund. Now, I'm going to close by explaining what I think is the single biggest risk to the future of private long-term care insurance. And that is that there is a consensus forming among the LTC intelligentsia, the analysts, the policy wonks, and the media, both popular and academic, that publishes them. Their consensus is forming around the idea of compulsory social insurance. This is like Medicare and Social Security, where the government says we're going to tax you and then give you a benefit, but there's never enough money to go around to pay an adequate benefit. And it has the effect of a moral hazard, reducing the public's sense of personal responsibility. So here's their argument in a nutshell. Long-term care is in crisis, granted, especially now in the pandemic. Well, I've just been talking about that. The middle class is unprotected. That's arguable. They do have Medicaid. Long-term care insurance failed. I don't think it failed. It succeeded beyond the wildest dreams people would have had they realized all the obstacles that the government was going to put in its way. But never mind. Big government programs aren't coming. That's pretty well established. Medicaid requires impoverishment. Oh, it does. Back to that in a minute. So our best hope is what Washington State is doing. Compulsory social insurance funded by mandatory taxes on workers and with a back end focus. In other words, you're responsible for the front end risk and the government will pick up the catastrophic risk. Well, there are a couple of flaws in this argument. The main one is their assumption that Medicaid requires impoverishment. It does not, and I have established this in many publications for a long time. Income rarely stands in the way of Medicaid long-term care eligibility because personal health and long-term care expenses are deducted from income before eligibility is determined. And assets rarely stand in the way because most large assets are exempt, such as a home, and assets that aren't exempt and are counted against the $2,000 limit are easily converted to exempt status. So that's the fundamental flaw in this argument. The rest of it is that if you look at the way it is being set out without any concern for the kinds of issues that insurance industry has to take into account before setting premiums and determining what's likely to occur, none of that has been seriously considered. The one good thing they've done is employed the Milliman Corporation to help them with some of that. But as you can see from reading the two items I'm linking in your notes, the Keystone Comps and Trust Fall. Keystone Comps is a LTC bullet I wrote debunking what Washington State is doing. And Trust Fall is a wonderful, much longer essay by Stephen Foreman of LTC Associates taking down the Washington State plan. Anyway, you want to keep an eye on what Washington is doing. Follow what I'm writing and follow the LTC clippings, and you'll know exactly what the risk is there. And I predict it will totally fall apart, but we'll have to wait and see. I'm going to explain why that Washington State analysis and the recommendation is wrong and doomed to fail disastrously in an article I'll publish in the February issue of Broker World titled Why LTCI Fails. But for now, bottom line, given what's happening in health and long-term care in the United States economy and politically, there's never been a better time to sell long-term care insurance. So that's a wrap from me. I'll be happy to take questions if there's time.
Yeah, we'll do a couple announcements, and then the only way we can do the questions today is if you guys type them in. But if you do get them to us later, we will also try to answer them or get them to Steve to answer. I just want to do a quick announcement on the winners of our raffle. The $50 winner is Roger L. out of Missouri. The $100 winner is Linda W. out of Texas. And the $150 winner is Stacy L. out of North Dakota. Steve, we want to thank you for just having a great conversation, letting them know really what the truth is behind everything. Sometimes we know and we think of all of these things, but putting it in perspective from a person who's worked on the Medicaid board financing for so long and can really see the repercussions of it. We as agents have to go out, do our due diligence, and really, really put a big foot forward. Again, I want everybody to think about the referral program. If you're not doing long-term care yourself, it's a great way to give some extra help to your clients. Now more than ever, they need the protection of long-term care. The nursing home system is falling apart. It's not safe to be in. And in order to stay home or get into a nice assisted living, you either have to have a truckload of money or be insured. So let's do our fiduciary responsibility and help these people out there. I'm going to, again, thank Steve for your time and your effort of putting this on. I don't see any questions coming in because I'm not very good at that, of finding them.
That's a good sign.
But when we do get
everything, and they understood everything I said.
That sounds good. Dennis, I'm going to turn it over to you to see if you have any comments to make real quick.
Steve, excellent job, and there's a lot to chew on as far as always when Steve gives his insights. And I think that my takeaway is that crisis brings forth opportunity, and uncertainty creates more of a need for your clients to get comfortable and know their solutions. And that's why at GoldenCare, having a perfect portfolio where we've got products that deal with fully underwritten, as Steve talked about the underwriting concerns, all the way down to no underwriting, where the focus can be just on a home care solution, that reach out to the marketers at GoldenCare to get direction. If you want the easier path because you don't want to deal, as we said, with some of the messiness, know that we have the referral program. It's there for you. It's a great way to let your clients get the help that they need by turning it over to our experts who write literally millions of long-term care. And I concur with Steve 100% that, I don't think there's any better opportunity right now as people are aging in and this is top of mind, that we address this and have the conversation one way, either by doing it ourselves or by turning it over to those that could do it for us through the referral program. And just want to thank Steve for his, long-term commitment to this marketplace. He's stayed the course when many others would have not, and he's been a very important ally for us to when he shares these insights. And so, John, back to you.
All right. Thanks, Dennis. Thanks again, Steve. I want to thank everybody who attended today. Wish everybody a happy new year. And let's go out and help our clients, help our friends, help our family. Make sure somebody has a longevity plan in place. And it's up to us to do it. If it's not your wheelhouse, let us do it for you and make some extra money that way. Steve, I want to thank you again. Wish you a great 2021 along with everybody else. And it was our pleasure having you on today. I hope everybody picked up some ideas, some sales strategy. Otherwise, don't forget to visit our website, GoldenCareAgent.com. That's www.goldencareagent.com. Or give us a call here at 800-842-7799. I want to thank you personally all again, and everybody have a wonderful day.
John,
take care. Enjoy the rest of the week.
If I could for just a minute. Sure. I want to let folks know that I'm very accessible. You can reach me at smoses@centerltc.com or on my cell at 425-891-3640. The reason I make myself so accessible is that I get a tremendous value from talking to those of you who are out there in the trenches of long-term care, dealing with real-life problems day in and day out. As you heard from my presentation today, I'm looking at everything from about the 40,000 foot level. And it's really important for me to see what's going on in the trees, not just the forest. So please never hesitate to get in touch. If you have questions from the program today, by all means, send them to me. I can usually respond often within minutes, usually within 24 hours, and it helps to keep me grounded in the real world as I work in these more abstruse areas of public policy. So thank you again for this opportunity. Go out, do great things, and you know, nothing we do in the policy area matters unless you guys out there actually selling the product are successful. So my heart goes out to you. Do great work, and goodbye for now.
Yep. Thanks again, Steve. And we are sending out all of Steve's notes. Steve, do you know if you have the link to the COVID article that you referred to? I think
that's
the COVID article.
There.
Yeah, the Margie Berry.
That hasn't been published yet. I'm just saying, keep an eye out for it.
Okay.
I think it's going to be on Margie's website. I've seen an advanced copy, but I'm not at liberty to share it with anyone else. But it covers a lot of the same material I've covered here today. And when you get the notes from this presentation, you will have live links to everything I talked about and the source articles on which I drew.
Perfect. Yeah, and we will send that out to everybody. Again, thanks, Steve. Thanks, Dennis, and thanks everybody who attended. You guys have a great day and a great year.